Mukha rogas. So in Danta and Dantagat rogas, Danta Moolagat rogas also we can apply Shara. So these are the classical references. So whenever in case of Danta Vaidarbha, we want some Chedana effect. So here Shara can be done for that Chedana. Adi Danta, as I told you, Shara Lepa. Like we have to keep the Shara that time also. Then in case of Danta Sharkara, reference of Yavakshara, so again it is a mild Shara that can be used for Pratisaran. So you can use it with honey. And then in case of Danta Puputa, so here we have to go for Rakta Mokshan, then followed by Panchalavana Yavakshara. This can be done. And then in case of Danta Nadi, we can use this Shara Danta. Or we can use, even sometimes we can soak the Shara and keep it over that area. Means you can take cotton and keep it over the area where you need the nadi, wherever there is nadi or sinus. So if you can use the this thing Shara Sutra, that will also give the same serve the same process. So this is the case of she is a PG scholar. So here she had some impacted tooth. So in that case I have used this Shara. Only she had severe pain. Even she went to the dentist. So I just wanted to go for like a simple measure. So I gave her just I applied this Shara. Only one sitting I applied, that pain everything vanished because that impacted tooth. There was space for the coming tooth, so everything vanished, all the symptoms. That is what we need to give the patient. Then coming to, because in Mukha Rogas we have wide scope, we can use it in so many diseases. So in ranula also I have so many cases wherein I have reduced the size of the ranula. Immediately you can get the result. Just one sitting or maximum 2 sittings. You can get maximum relief. So as you know, ranula, they say tongue underneath the surface of the tongue. So its appearance will be same like that only. See. So this is the case of ranula. So this was the first sitting I have applied. So here you can see how it is. Then in second sitting again I applied. I admitted the patient. There was slough formation and little tissue was there. That also I removed in second sitting. So just with 2 days of treatment, the patient got maximum relief. And it is so because when you do surgery, I had a patient. This patient, she was operated so many times for this ranula, and there was pus discharge. And this patient, actually she came from Bangalore, and she left her job. She was a software engineer because of the repeated how many operations she can undergo. Again and again that swelling is. So when she came to me, just one sitting I have applied Shara. See, after applying, see how it has flattened, and all that tissue came, whatever pus formation, whatever infection, inflammatory exudate was there, everything got removed, and there was perfect healing and complete recovery for that patient. So this also a case of ranula. So it was only one sitting I applied for this. So it was a little chronic type. So after application of one sitting, there was relief to the patient. Then in Tundikeri, we have very good this thing. You can apply Shara in any type of tonsillitis. Either it is parenchymatous or fibrotic tonsillitis, or it is follicular type. Any type you can apply. So you can, but application it is little difficult, especially if it is a small child. You have to, patients will, some will have gag reflex. So you can use the spray here. In that time you can easily do the procedure. So this patient also, we can give very good result. So because nowadays tonsillitis is very common, and especially if we operate also, there will be so many problems afterwards, because anyway it is a lymphoid tissue. We have to try to save it. So later on there will be many problems. So this boy also got very good relief, and there was no recurrence. So this boy also 1 week, he had huge parenchymatous tonsillitis. So he had not only tonsillitis but also adenoids also, adenoidal hypertrophy was there. So for this tonsillitis I have applied Shara, and for adenoids I have used this Nasya with Shara. Okay. Also you can give, he had this repeated snoring and choking spells. So these two are the indications for tonsillectomy when we look into this thing. But the parents, they were not interested for operating, so that's why he came to me. So and he was not able to concentrate, all that this thing was there. And when he came to me, I've applied this Shara. 3-4 sittings I have done for this. So he got very good relief. So along with that, I have used this Kamchanara Bugul, then Varunadi Kwat I have used. So very good. And first I have used Apamarga Shara Taila. Then afterwards I have also used Bala Taila. So there was very good relief in this patient. So you can see. So because the tonsils were actually of kissing type, it was so difficult to apply. He had dysphagia also, and gag reflex was too much. Even little this thing, he had this gag reflex. But after applying, he got very good relief. So you can see the patient testimony also. So you have to do at least 3 sittings of the Shara. So in this chronic fibrotic type also, you can apply Shara. So it gives very good result. You can see the size has reduced, and you can see the reduction in the size of the tonsils. Postnasal drape, and in case of granular pharyngitis also, I have applied the Shara. Posteriorly, you can see here there is pharyngitis and granular pharyngitis type. For those lymphoid aggregation of tissue, there also you can apply the Shara. That will also you can, but you have to be little careful. See, I have applied. So you can directly, I am applying. First I used to use the cotton swab, and then I used to keep it on that area. But that you can start as a beginner. But later on you can use it directly, because immediately your hands should be skilled before start. And you can learn with this Tankan Basma. Tankan Basma can also be used initially to apply Shara. That will give little less result, but you can learn. You can start applying that, and then you can later on use the Apamarga Shara. That will also give very good result, especially in some children where they don't cooperate for applying the Shara. Then you can use it. So this is also the case. See, I have used with this spatula. I have applied the Shara. So in with different instruments I have tried. So which is convenient for you, you can use it and you can apply. So whenever you want to apply, you can create a OT type of this thing, feeling for the patient. So you can do it under a minor OT, and you can give that surgical feel also when doing the Shara. So I have so many patients, they have visited. For one patient, there was turbinate hypertrophy, and some person has charged him 30,000 for application of Shara. That patient came to me. So that is also misusing this thing. We should not charge that much. At least 30,000 who will charge this? They have paid, and again he came to me, there was recurrence. So in that way only Shara will not help. You have to go, you have to treat the condition as a whole. If there is allergic rhinitis, you have to treat him with systemic medicine, with Nasya, and with this thing also. You can treat the condition as a whole. So this is the cases, because usually in my OPD I do lot of this thing. Even I have given a trial of Tundikeri, so that will also, you can start your trial also, that will give very good result. So this is a case of submucous fibrosis. So Shara Pratisaran, I told you, we can do it in this way. So leukoplakia, I have done this, and even in the case of submucous fibrosis or cases, I have done Shara Pratisaran. So easily we can do it. So you can see the effect. So you can see the effect, how it has leukoplakia to some extent. So this is the second sitting, but after that you can get very good result. So next is a case of varicose ulcer. So this you can see how it is. You can see the surface how it is. When I applied Shara, it was like this, and there was a lot of bleeding. but I had gone for a biopsy. It was not, it was negative. That's why I put him on Shara. Otherwise, if it is CA, then you have to take the proper line of treatment. So you cannot do Shara and simply waste the patient's time. So you can refer that patient. But here, since he was not, it was not a case of CA, I applied and very good result he got. So you can see. So this is also a next case. What I have done, this hemangioma, capillary hemangioma. For this patient, I applied Shara also. I had done the next procedures. I will show you. So Shara also gave very good result. So in case of capillary hemangioma, even though little, because it is in oral cavity, there will be little difficulty. Like we have to use high dose antibiotics and all afterwards. Otherwise, it will become problem. There will be dysphagia, etc. So you have to take care of that. Okay. This leech, this I have also applied the leech. This should come in Raktamokshana. So I will show you afterwards. So this next case is also varicose ulcer. Here also you can see I have applied Shara. So this patient also got little relief. But he has not followed. Only 2 or 3 times he came maximum. After that he has not come. But there was a lot of reduction in 3 sittings. So that horny type growth was there, that reduced. Then in Shirorogas, where we can use in case of dandruff, then seborrheic dermatitis, any psoriatic lesions of the scalp, all these conditions directly, if there is any lesion, pitika or anything, you can apply it, or you can ask the patient to go for Shala Jala, washing, prakshalan of this thing. So next coming to Agni. So Shara is a very superior technique you can follow in so many diseases, as we have seen, ENT diseases. Then next coming to Agni Karm. So this is also a very important procedure, instant pain relief method, and it is the best, like if a patient comes with acute symptoms, you can give him best result. So even in case of Netra Rogas, they have mentioned in case of if there is repeated in Vatma Roga, they have asked us to remove burn the hair follicle. So here we have to use the Suchi, dystrachiasis, Pakshmakopa, etc. You can use this Agni Karma. So instead of first you can do epilation also. After that you can to that hair follicle you can use a Suchi, burn it. I mean you can warm it in candle flame and then you can apply it on that follicle. That same result we can achieve. Okay, so you should be little careful when we are doing it for the Vatma. Then in case of Shirorog as well as Adhiman, in Shirorog there is a reference that if the headache does not get treated from any forms, in medical, surgical, parasurgical or anything, then you can go for this Agni Karma. That is the last treatment what we can do for the patient. But they will get very good relief. With especially in case of Bhru, Lalata and Chanka, you can go for Agni Karma. So in case of Vatma Rogas, in all these conditions we can, I mean this is Shara, no? Shara I have left out because this is not in ENT subject. So in, again it is repeating, so in Agni Karma you can get here again the medicine, like this effect is also near to surgery and pain relief is maximum in Agni Karma. And also here also wound healing, self wound healing. Whenever you need not take care of the wound, that will automatically heal. It will cauterize the tissue, it will form a slough and it will come out. So it will usually in case of keloids and other conditions we can use Agni Karma. So here I have used in this what marshes I have used, and in case of this is the case of glaucoma. So this there was severe pain. So in this patient I have done Agni Karma. Then in case so what instruments we can use for Agni Karma nowadays? Like we have so many techniques. We have this Panchaloha Shalaka. Even we can use the Suchi. But in those days they were using this drugs. So I use Pipali also, especially when I have to do Agni Karma in eye. I use Pipali. Pipali is very effective because it has a small base. We can easily apply on the lesion. pinpoint, you can apply, it can be applied on the lesion without touching the other area, especially in case of warts. Can be found in eyelid also. There also have applied very good result, because ophthalmologists, they usually ask for surgery. Again, it is so costly procedure, but with simple technique, you can, in one sitting only, you can remove that wart or whatever it is. So you can, in case of honey and this thing, ghrita also can be used to make it hot in case of krimi dant. Wherever there is pain, you can fill the this, in case of um, dental conditions, you can fill that orifice wherever there is krimi. You can go for this technique. So that will give very instant relief in pain. So these are pain relief methods. So in that way, you can go for this. So wax also can be bee wax. That also is made liquid, and then you can fill it. So it will form a temporary filling also. So that cavity which is exposed, we can fill that area. It will not only suppress that pain, but it will also give a type of temporary filling. So it can be applied. So usually jamun also they have told, when it is broad base, I have not used it. So in this way, so this Agni Karm, it will cauterize and it will reduce the Vata and Kapha doshas, and it reduces the pain, targets the pain. So there are various theories according to this theory. So whenever there is heat is applied to a specific area, then metabolism in that area will be improved. So when metabolism is improved, there will be rejuvenating changes. Blood circulation is improved, and there will be some that whenever the tissue sloughs in that area, there will be increased demand for oxygen. So that is why blood circulation will be improved, and there will be rejuvenating changes and nourishment of the tissues. So that will help in elimination of the, when blood circulation is improved, eliminates the toxins from the site of lesion, and self-healing will take place. And in case of pain, so this is the, so whenever we apply heat, so it will block it will be release of endogenous opioid. So this opioid inhibition of this, it will give rise to this presynaptic inhibition. So opioid receptors will give rise to this presynaptic inhibition, that is the cause for the pain, and they will block the pain receptors. So in that way, immediately after Agni Karma, you get very good relief, especially in case of migraine patient. So when the patient comes during the attack, so and again you have to see whether it is Vata Kapha migraine, then you can apply Agni Karma. If it is Pitta vascular type of migraine, then you have to go for Jalokaawcharan. And if it is so in this way, you can select which acute cases, you can also go for Agni Karma. So this is also one theory, especially in case of pain. So muscles will be relaxed. So when muscles are relaxed, naturally the spasm is relieved, and thereby the patient will be. That's why in case of other pain, avabhavika or any sciatica, the pain relief is maximum because of the release in muscle spasm. So in warts, I have used only one sitting. See, it was like this. So after that, it became small and then fell off. So no need of post-operative care also. Immediately it will itself, there will be self-healing. So this is a case of okay. That was a case of glaucoma. So in intense pain, whenever a patient comes, if it is a stage of absolute glaucoma, that time the pain will be more. So patient will be so much furious about the pain. Somehow he wants to get rid of the pain. So even though there is no vision, so we can go for Agni Karma and we can give that benefit. So I have done to so many patients. Immediately after one sitting, we can give relief to the patient. 50 to 60% pain relief will be there immediately after one sitting. Then you can go for 2 to 3 days. You can again call and do 1 or 2 sittings. That will take care. So in case next coming to Raktamokshan. So main Agni Karma can be done for warts and all this type of swellings, and in case of pain, whenever you want pain management, you can go for Agni Karma. Then coming to Raktamokshan, so we can use it by Alabu, Jaloka or any form, and even Prachan also can be applied here in Raktamokshan. So you can go for this Prachan type also I have done, and in case of this follicular conjunctivitis also we can go for removal of the follicles. with this Raktamokshan. So usually I showed you that Lekhan, that also can be done here. Lekhan I gave you for that eye, Shefalika Patra Lekhan, that also comes under this Raktamokshan. So you can use that Shefalika Patra. I have used Samudra Fen also for giving the same effect. So it was very good Lekhan. So here you see different cases. So we can also go for Siraved, and we can club both the procedures and we can do. So this is the same case. Morning also I was discussing. See that periorbital swelling was there in that patient. Same patient. And this patient I have done Siraved, especially capillary hemangioma I told. I have done Siraved. So wherever this also gives very good results. Siraved, and then after that I have done Jaloka also. And in case of caviar tongue, there is one more case. I did this Raktamokshan with this needle only. It will give very good result. So this is the case of Prachan, so alopecia areata. So this patient also I have done, I have done Prachan followed by Lepa. So this case also got very good relief. So she was a small child. So and now she has very good result. So that is why like follow is important. Afterwards she has not approached me. So we have to see how it is. So Jaloka already I have discussed in eye. There was a complete session, no? So you can see how it is. The effect of Jaloka. So this lady was a very nice patient, and a very good relief she has got. See, you can see how the swelling has reduced. You can see the huge swelling, how it has reduced after repeated Jalokaawcharan. All her videos are there in my YouTube. You can watch. So leech therapy. Externally I have applied. Internally also I have applied. So in this way, very good result we can get. Then one more interesting case, we can apply leech therapy even for colloid goiter. So this is my innovation. I have used it and I have got very good result in this patient. So he was this patient. He came to me with this thing, huge swelling. So that swelling had pushed the aerodigestive tract to the other side. So he had dysphagia, and this voice also was not in a proper this thing. He was having difficulty in speaking and all. So this patient was advised operation by many doctors, but he was not willing for operation. That is why he came to me. So I have done Jaloka. Only one sitting of Jaloka, because when I saw his this thing USG, they were more of inflammatory cells, exudates, all that. So that's why I thought better to remove all that. So best technique is to use Jaloka, and I have used, and he got very good relief. See this patient, and along with that I have given him this treatment, Kanchanara Bubul, then Varunadi Kwat. He was taking 100 micrograms of this Thyronorm. So that was reduced to 75, then now he is taking only 50. So that dose also was 125 I was taking previously, then it came to 100, then 75, now 50. So in that way we can reduce the size also. So this is also a second patient. I have done Jaloka, and after applying Jaloka you can get the result. So this swelling I told you, how much it was reduced. So you can see how much mass was 68, 62, 85, and it had pushed the aerodigestive tract to the other side, with all the symptoms subsided after one application of Ksharakarm, and you can see how it has reduced now. I think it is swelling is very minimal swelling. So now patient is again on follow-up. I have not added, I think one more slide was there. I have not added. Because in this there was inflammatory swelling, that's why I planned for this Jaloka. It gave very good result in only one sitting. All the symptoms reduced. So this is also a case of capillary hemangioma, very good result. You can see the tongue before and after, and you can see how this thing it had spread to under surface, dorsal surface, everywhere we had this capillary hemangioma. So that I have also done this Jaloka, Siraved, I have used Shara. All the three multiple treatments I have used, and you can see the result. So he has got very good result. So almost his tongue has flattened. He was not able to speak properly. So when he came to me, he had slurred speech. We couldn't understand anything what he was saying. But now he speaks very nicely. I have his video also. You can see.
Hello everyone, myself Dr. Shamsa Prayas, working as professor and HOD in National Institute.
You can see my video like that.
Today,
because it will take more time. So in this way, we can go for we should know where we have to do the procedures. Okay. So when we have to do prachan, so how much rakta can be, how much area will be covered? That rakta dushti will be covered only up to 1 angula twak. That is the area which will enclosing. So prachan fidu only that 1 angula area blood will be drained out. So you should have that basic idea. Siraved means you can get this entire, it enters into the systemic circulation. That is why I told you in morning also, BRVO, CRVO or any systemic disease is there, you can go for. Because not only it will correct in the particular area, but also systemic results can be achieved. And also this Jalokaawcharan, hasta matra, like one hasta, this thing it covers. And Shunga, the Shangangula and Alabu. Alabu I have not done, but same nowadays Ghati Andra, Alabu, all that we can use in cupping also. Cupping I have used. I have done it for many patients. We can get very good result because Alabu and all are not available here. I mean nowadays, but we can get the cupping instruments. We can use that. I have used for many, so it will also give the same result. Okay. So this is also Siraved. So you should know what are the Samlim Lakshanas and what new technologies we can adopt. So we can use this scalping method, but it will not give that much this thing blood, rakta. So what I have done after pricking it, I apply the this thing Jaloka. So you can get 2 in 1 effect. It will enter the systemic circulation also, and you can get very good result. So we can do. This is a case of caviar tongue. So here also we have done, I have done this, usually Siraved I have done in this, all the vessels, small veins, whichever was dilated and cancerous, I have done. That time I showed you the video. So in this way, in case of Siraved, we have to see which dosha is vitiated, especially in Vata Prakopa, and also in case of Kapha disorders, we can go for this. And also in case of Rakta and Pitta Dushti, there also we can apply, especially in the vascular conditions. So you have to follow this SOPs as I told you in morning session also. So you have to keep all the things ready, patient preparation, then the instrument preparation, then all the profile where you have to get the investigations done, and then also take consent. That is very important. If anything goes wrong, so, and it is also in NABH, this thing we have to explain the procedure to the patient, and you have to take his consent before doing it. And then you can also before and after you have to prepare the site. You have to use hygienic condition before. You can use gauze also with the slit, and you can clean the whole area before applying. And usually for you can use this thing oil Abhyanga also, that will give especially if you want to do Siraved, Abhyanga will give rise to dilatation, better dilatation of the vessels. You can easily apply, otherwise it is very difficult to locate the vein. And you have to do aseptic dressing afterwards. After Jaloka, as I told you, morning session also will have many complications. So this is the mode of action. Already have explained what happens in this thing, Jaloka, what it contains and how it is acting. So especially in migraine headache, we can get very good relief with Siraved as well as with Jaloka. So here this is the technique what I do. Because in acute attack, whenever a patient comes to me, I usually we have to manage the pain. in between the attack, we have to go for Nasya and other therapies. So first you start with, there is head pain when the patient comes to you, go for Siraved or Jaloka. Or you can use this two in one technique, and you can see first you have to make a small prick. See, I have made it in the vessel and then I have applied. And when we remove that, directly I will put the Jaloka mouth there only, and it will suck out. Sometimes it will be very difficult that Jaloka it will not apply easily, but once it applies, it starts. So we can do it. So we have a lot of parasurgical procedures we do, and we get very good result. See, result is almost next to surgery. That same effect. See, polypectomy patient has having done 8 to 9 times, and they have come to Ayurveda treatment, and with single treatment they have got very good result. Because I have many patients who have underwent polypectomy, who have underwent tonsillectomy. All those patients, they come to me. So they have some other disease like there will be hypertrophy of the lymphoid tissue, all that, those who have undergone tonsillectomy. Again, we have to manage such patients. So, and in case of chronic tonsillitis, hypertrophy of the pillars, there also you can do Tikshna Nasya, and after that you can, if there is more hypertrophy, that time also you can apply little bit Shara, but be careful when you are applying. So whenever we do any procedure, it is always very good to publish, so that people will also know what work is going on. So you can prepare many such like papers and present your individual work, so that it will be helpful for the society. Because nowadays the whole world is looking at Ayurveda treatments, and what can be done for those diseases which are not having proper treatment. So when we put it in the form of articles, we get a lot of this thing scope, and Ayurveda science will propagate. Okay, thank you for. If you have any doubts, you can ask.
And if we are applying Kshar in the oral cavity, then what should we do after? Simple
Lime juice I use. Lime juice only.
And after how much time we can take?
1 minute I apply Shara, and after that I neutralize the place. That is very important. And then afterwards he will be okay. You can usually for tonsil, if I apply Shara for tonsils, I also gargle with Triphala cloth. He will gargle nicely, remove whatever condition is there.
How much time that person should avoid to drink?
Half an hour at least minimum.
Any special precaution?
Special precaution, especially when we are doing for the throat, because that Shara sometimes if you don't apply it, it will go into the throat. Sometimes it will cause laryngeal edema also. You should be very careful while applying. So you should be little cautious. And proper management also is important after that also. If you anything happens, you have to manage. If you cannot, you can refer it also.
You told a case, Ksharakarm in AC. So what was a Ksharakarm in that vision? Specifically in the eye, when
While applying, you should avoid the eye, and you should see that the Shara doesn't. I cover the other area of the eye when applying, and only that lid I apply, and I cover the rest of the area with cotton, and then I will after applying 1 minute I keep, and then I remove it nicely, and then I wash with Triphala. You have seen Triphala Jala, and then clean it nicely, and then.
there is no irritation after.
Irritation will be there. I give them antibiotic. I drop Paracan if there is pain, but gives good relief. Anything else? If you want?
In keloid Kshara, so whether it is better than is Jaloka or
Steroid, it is better for Agni Karma. Agni Karma is best because it is very hard tissue. So whenever there is, see for that also they have bifurcated. When the swelling is flat, there you cannot do Agni Karma. You have to apply Shara. When the swelling is Utthana, when it's elevated, that time you go do Agni Karma. We can club the two. In periauricular tag also I have done this Agni Karma I have done, and only with this procedures I have treated. There is my video is also there. So I have done this thing, Shara, this sutra I have tied around that, made a knot around that, and the upper portion I have burnt it. And then after that little portion what was remaining, I applied Shara also, and I have used all these multiple therapies to give good result. So that naturally that slough tissue, everything it fell in 1 week.
In eyelid margin candidate को only Agni करना और एक Ksharakarm.
Flat growth I was there, no, I did Agni Karm. If it is elevated, Agni Karm, like if it is very flat like that, that time I did
Hanging tag.
hanging type, Agni Karm only will be better. So if it is very small flattened growth, no, that time you can apply Shara, but Agni Karm will be very very. In case of inverted papilloma, one more case was there. There also have applied Haridra also I use Haridra for burning. So Haridra also gives very good result. Then I have used Shalaka also, Panchaloha Shalaka. That will same.
In Xantholasma, have you used any
Xantholasma I have used Shara. We can use it because that also Apamarga Shara we can apply, no problem. On the skin surface, mucosal surface 1 minute is enough, but for skin surface minimum we need at least 10 minutes.
What are the results with that? There are a lot of them.
We can apply, it is a good result. That's what time period will be, duration of time, especially on the skin. We have to, because whenever there is scar formation, hypertrophic scar was there in one patient on the nose. There also have applied Shara, very good result. Nicely that keloid, it will disintegrate with Shara. But you have to keep at least for 10 minutes. Because 1 minute will not be sufficient in such case.